Everyone has heard of a concussion or seen one happen firsthand, but what does that really mean and what are the potential issues associated with these types of injuries? Today we will be covering neck-related injuries in athletes and how chiropractic care can help return you to optimal playing condition. When talking about neck injuries in athletes, it's important to first understand the various types of injuries that can occur in this area. Some common neck injuries that athletes may experience include whiplash. This is a type of injury that occurs when the head and neck are suddenly jolted in one direction and then another, which can cause strain and damage to muscles, ligaments, and tendons in the neck. The next is cervical strain. This is a common injury in contact sports such as football or rugby and occurs when the muscles and ligaments in the neck are stretched beyond their normal limits. Cervical fracture. This is a serious injury that occurs when one or more bones in the neck are broken. It can be caused by a direct blow to the neck or severe twisting motions. A herniated disc. This occurs when the soft tissue between the bones in the neck, or discs, are pushed out of place. This puts pressure on the nerves in the neck, causing pain and discomfort. The next is concussion. This is a type of traumatic brain injury, or TBI, that occurs when the brain is jolted or shaken inside the skull. This can happen as a result of a blow to the head, a fall, or a sudden acceleration or deceleration of the head, such as a car accident or during sports activities. And the final one is a burner or stinger. Burner syndrome, also known as stinger syndrome or brachial plexus injury, is a nerve injury that occurs during contact sports, particularly those involving collisions or impacts to the neck or shoulder area. It typically affects the nerves of the brachial plexus, which is a network of nerves that runs from the spine through the shoulder and into the arm. So what should you do if you or your child has suffered a neck injury related to any types of the injuries mentioned previously? In most cases, if they are sports related, the individual will have a field evaluation performed by a licensed trainer or physician. This evaluation is primarily done to make sure all vitals are functioning correctly and that the individual is cleared to be moved off the field in a safe manner. After the on-field evaluation, it is imperative that the individual suffering from a neck injury has a secondary evaluation by a specialist such as a chiropractor or physical therapist. Most of the time, the injured player will feel fine, but remember, this is usually due to the large amount of adrenaline they may have in their system. It is always recommended to get a secondary evaluation, as they may need radiographic imaging or other neurological testing in order to be cleared to return to play. So what are the next steps? In most cases, once an emergency situation has been ruled out, imaging will be performed or ordered by a specialist such as a chiropractor. This will usually include x-rays and potentially followed by an MRI. So what can a chiropractor do for neck injuries? Chiropractic care can be an effective treatment option for certain types of neck injuries, particularly those involving the joint dysfunction, muscle imbalances, rehabilitation following an accident or trauma injury, and muscle tenderness or soreness. And chiropractors are trained to identify and treat musculoskeletal problems that can contribute to neck pain and stiffness, muscle strains and sprains, and disc herniations. Chiropractic treatment for neck injuries typically involves manual manipulation of the spine and its surrounding structures to restore proper alignment and function. This can include specific techniques such as spinal adjustments, mobilization, soft tissue therapy, and stretching exercises. Chiropractors may also recommend lifestyle modifications such as ergonomic adjustments to workstations or changes in exercise routines. This can all help prevent future injuries. Looking back on my personal experience, I was blessed to have an individual as a father who is a chiropractor who made sure that whatever sport I was doing always had some sort of neck training strengthening program. Now, it doesn't have to be as elaborate as a full-on machine. It can be something as simple as a resistance band tied to a doorway with a actual hook that locks on it, with a band that kind of goes around your head. I always recommend anybody that is in wrestling